Hello, Black-owned economy, and welcome to another edition of B.O.E. Live Rooms. Today is episode 6. It's the 6th episode that we've got from 2021. The theme of April is all to do with businesses which were set up in 2020, talking about how they've managed to deal with 2020. As we all know, 2020 was a unique year in a number of ways, but we're trying to focus on the positives, and what better way than approaching businesses that were set up in that year and are still thriving today. So today we have a lady called Funke, who's hosting. The session is all to do with health and well-being. I won't talk too much about her or her business because I want her to talk about her business herself, talk about her own story. So without further ado, I will hand over to our host this evening.
Thank you very much, Jeremy. I was speaking to him before the break, and I think just whilst we're live on air, I just want to say thank you to B.O.E. I think it's a great initiative and a great thing to be a part of. And thank you for having me. I really do. I don't take it for granted. I know the journey I've had over the years, and to have a platform like this is really, it's an amazing thing. So thank you, guys. So just to introduce myself and give you a bit of background. So I set up WESIE Integrative Pharmacy. We went live at the beginning of sort of May last year, so bang in lockdown. So the backstory is a bit long and I'll try and keep it simple, but basically I sort of been running an NGO and working, and I think along my journey at work as a pharmacist, I used to work as a specialist HIV pharmacist and then moved into primary care, and one of the things, starting from when I worked as a specialist HIV pharmacist, HIV was something that predominantly affected your LGBT community as well as Black people. Now, a lot of the policies, the marketing, a lot of the people that sort of make decisions, I kind of noticed there were, although you have a lot of people working, a bit like the NHS in general, you have a lot of us working, but not when it comes to making decisions. So that means that this was my observation coming up, that a lot of the decisions makings, a lot of the policies, a lot of the way things were done with the best will in the world weren't always tailored to the community. So I initially started doing talks in churches and community to raise awareness, ended up writing a book. And along this time, I also used to be an athlete. So I was, doing my sports as well. I used to play basketball. And then there just came a point where I felt like, number one, I wanted to, have an impact in sports, but I also recognized the link with health. And I was starting to develop professionally, do my master's and all those things, and, learning a lot about policy and just thinking about what I could do to make things better when it came to health within our community. So I was doing that, and I did that for about 8 years without any funding. So you can imagine how challenging it was. It took me abroad, so I still do stuff abroad. But closer to home, professionally, I was sort of growing and experiencing some of the challenges when you get to mid-level, etc. And, I was starting to think I needed to set something up, partly because of, not getting funding to do stuff in the community as a way of getting funding, but also from a professional point of view, in terms of being able to do more that I felt wasn't being done in service. And at that same time, I had a trigger because patients were always asking about herbs and supplements. And a lot of the time, we used to say you can't have it because it will interact with your medicines. And, and to be fair, sometimes there were some nasty interactions that, in some cases, patients failed treatments. They had all sorts of other things happen because they didn't ask us first. But a lot of times when they ask us, we would give them a standard answer. We do the checks and say, okay, yeah, maybe you can get away with it. But I think I had this one patient that just wouldn't go away. And I said, you can't have this because this is not going to work with your meds. And he was like, well, you tell me then, what can I have? And I was like, sorry, that's not my job. You know, I have a queue of people waiting for me that I need to deal with. You go away, find out what you want to take, and I'll tell you if it's okay. And the patient was very insistent. And then I had a light bulb moment where I was like, you know what, you're not being very helpful here. You need to do more to assist this patient. This patient's dealing with a long-term condition, but they're trying to be well and deal with their other aspects of health. And I think that's when I thought that I need to set up a service dedicated to, you know, to people with long-term conditions, especially people living with HIV. Then obviously working in primary care, very general, dealing with the human side of things. You know, I have family, I have friends, and I can see some of the struggles my family people are going through. And I look through the generations. The other day I was talking to my mom and I was like, what's going on? You know, I remember grandmom, I remember, you know, my great aunts living to 9600 and really living well. When they died, it was like old age. It wasn't because they were sick and all that. But yeah, I'm seeing some of my aunties and my uncles, and I'm like, it's not adding up. You know, it's not the genes. I know it's not the genes. So what is going on? You know, so, you know, but then working, you know, I still work part-time in the NHS general practice, and, you know, you're quite limited in terms of how the time and what you can do with patients, etc. And I often have a lot of people, especially from that are Black, that sometimes I speak to them and they'll be honest with me and say, you know, yeah, those places you send us to, sometimes the information they give, what they're talking about, it just doesn't relate, kind of thing. So all that together kind of led me to set. So it's a mixture of things. It wasn't just one thing, setting up a business. So that's what led to WESIE Integrative Pharmacy. And really, I felt the need to set up something that, knowing that herbs and stuff are just very popular within our community. And I think it comes from history. It comes from the fact that there's a lot of mistrust in mainstream medicine. You know, so the question I started to ask myself is, how do we use this in a way that is more beneficial and we're able to get the best of both worlds? And that's why I say this is our theme, about bridging the gap between medications, herbs, and well-being. And these are our services. We've added weight loss and a few other things here. So I'm just gonna give you a bit of, talk a bit about the pharmacy, what we do. And then I really want to make this an interactive session. I really want to, because I feel even for me in what I'm doing, I feel definitely there's a role for herbs and supplements, but when I think about how many of us use it, but yet the statistics when it comes to health is still, there's still a lot of questions and issues. So clearly they do something, but clearly it's either we're not using them to the best we can, there's still some gaps, kind of thing. So it will be interesting to hear what people's experiences are and share, and not just me talking at you. So this essentially is what we're about. And really our specialty, probably what separates us from a lot of other, you know, private healthcare practices or sets up, is our goal is really to help people realize specific health goals. So these are some of the key things. So weight is a big issue. And it's not enough to just tell people diet and exercise, because a lot of people know they need to eat well and exercise, but they still struggle. So there's other things that can be done. Then fertility is actually a really big issue within our community. In terms of the numbers, you know, many of us are having children later, single children. Some of us are in churches where they're like, you know, just don't do anything till God sends you a mate. You know, and, you know, that's also an issue. And the statistics compared to other communities is not great in this area. So these are some of the specific things that we are trying to help people address. And then the other key one is to prevent, in some cases reverse. There's a lot of people that get diagnosed with long conditions like diabetes, hypertension are common ones that, you know, with the right support can actually turn back the hands of time, depending on where they are in the trajectory. And also to improve management. Some people have these conditions and they're just on loads of different medicines, they're trying to take supplements, etc. So we are trying to help manage it better, you know, to delay the progression to worse and other things, so to speak. So it all depends on where you are. For some people, it will be about preventing. For others, it will be about turning things around. And for others, it will be about stopping things from getting worse. And we look to create unique health plans. We have a population-based health system, which is great in terms of public health, but has its limitations. And we try to look at the patient as an individual in our pharmacy and my consultations, and to tackle the issues and give them solutions that will work for them as an individual. We're a pharmacy, so I'm not the kind of pharmacist or health professional that will tell you that medications are rubbish. There are times where medications are really helpful. So we do offer medicines and general pharmacy services. The only thing we don't do is NHS prescriptions. And that's because, as you can tell, we're a unique pharmacy, and to do NHS prescriptions, you kind of have to do everything in a certain way. So which is a bit limiting and against kind of what we're trying to do. So this is just to highlight some of the key differences between us and your general regular pharmacy. We're an integrative pharmacy. There aren't many of us. I don't think there are any at the moment in the UK. It's something that has taken up in recent years in America and Canada, maybe a little bit in Australia, but it's new here. And that is essentially like a form of practice. So now it's kind of like an integrative pharmacist, because I deal with, you know, taking the best from herbs and conventional and trying to guide people. Most normal pharmacies are just about medicines purely, not about bridging the gap. So that's kind of what they do. So we do what I call an integrative well-being consultation, which again is about meeting certain goals, but really blending the use of herbs, supplements, and medicines in some cases, and helping you to get the best results possible. In some cases, it might be that you need less medicines, etc. And we also, I'll talk a bit more about how that works, but what you will probably get in a general pharmacy is what we call a medicines use review, where they'll talk to you about one or two of your medicines, and advise you. We kind of do the whole package, and we'll look at everything. So if you're on 5 medicines, we'll look at the whole works in the context of where you are. And then weight loss. You know, a lot of pharmacies do this, but it's often tied to just medication. We do this, but it's not necessarily just tied to medicine. So for some people, yes, the medications, having that medicine will help them get to their destination faster. But for other people, it may not be a medicine that they need. There may be other alternatives they need. So we kind of set up our service to actually give you the best fit for you. And then, like I said, health plan, health goals. And then most general pharmacies rarely cater to specialist conditions or needs. We have a dedicated HIV care service, which means that patients living with certain stigmatized conditions, we help them and support them. We're in the process of setting up a fertility service, so stay tuned for that. And regular pharmacies, like I said, will do both NHS and private prescriptions. We only do private prescriptions. I'm a prescriber, so I do the prescribing. A lot of general pharmacies, you have a few now trying to do prescribing, but most of them rely on a third party. In terms of online pharmacies, a lot of them can be a bit distant and you're just a number. I think maybe the difference with us is that we're a bit more personal. You know, so we are online, our services are virtual, but we believe in, you know, having that personal relationship and contact with those we serve. And this is just a breakdown of what we cover in our consultation. So, you know, we analyze your lifestyle, we look at your behavior, we give you some dietary advice, we set SMART related health goals, give you a plan, and then we give you medication, herb, and supplement advice, and we follow up. We follow up, and we follow up for free, just to make sure that you're on the right path, you're able to implement things. Normally we say give it about 3 months for any program to work. Similar thing with the weight loss, but a little bit more specific. whereas this is a bit more, the integrative is a bit more holistic. Then we do complimentary mini consultations, and that's if someone has a specific query or a specific need in terms of a medication, a supplement, or a herb. So, and what are the benefits? I know that some people will question, do I really need one? I mean, anything I need, I can just pop to the GP, or I can pop to my local pharmacy. Well, this is the difference. And I think the proof is in the pudding with the people, you know, that I've dealt with so far. Like I had one, I think, you know, they were on the operating list, you know, for cataract surgery. And, you know, they told them that it wasn't yet time, but their eyesight was just getting worse and worse. And then they had some, you know, they were old, but I would say healthy old, you know, like some, you know, joint pains in their knees, and then some leg swelling. And I think through dealing with them, I was able to give them a couple of supplements and herbs to supplement some medicines they were taking on an as needed basis, give them something to rub on their joints. And I couldn't believe within a month, they came back to me and said, oh, they've taken me off the operating list because my vision's now back to where it was before. And, you know, the swelling in my legs gone down the joints once I rub what you gave me and take, you know, some of those supplements, you know, it's just, I'm good to go. So that's an example of a really holistic approach to things kind of thing. We've already been told we can't prescribe supplements in the NHS. So, you know, how I would deal with that in practice is a little bit different. Not that I don't have an impact kind of thing, but it's, you know, you're kind of limited by the system in a way kind of thing. So these are, and I've just used that example really to highlight all this and the benefits of a one-on-one consultation. It's about being achievable, what's realistic, helping you to interpret numbers, you know, and really putting things into context for you. And then there are some people that are high risk because they know that, oh, my mother got dementia when she was 60, or my mother got cancer when she was this age, and, you know that they have some risk factors and maybe just need a bit of help to make sure that they don't follow in the same path. So that's the benefit of having one-on-one stuff. So just a quick one about herbs, vitamins, and minerals. And, you know, this is kind of, I spoke a little bit more about this. I did a session on COVID-19, sort of, you know, a couple of months ago. I think that was last year. And this is just in general, my perspective on where herbs, vitamins, and minerals fit. And I think that in some cases, I don't know about them being a cure for certain situations, but I definitely feel there's a role to play when it comes to preventing certain things and also supporting certain things. So if you have an ailment, they can probably support you in the healing process, you know, or prevent things from getting worse. So there's definitely a role, even alongside mainstream medicine, but it's how it's used kind of thing. And just taking the odd herb here and there sometimes isn't enough. And, you know, just a little bit, there's a lot of research going on around a lot of supplements at the moment, especially because of COVID-19. But I know from experience, the right dose, bioavailability, and context is really, really important. And oftentimes people will ask me, oh, so what can I take? Oh, I heard vitamin C is really good. I heard vitamin D, or I heard this herb is really good. For me, the right dose is so important. And I use vitamin D because it's a really popular example. The guidelines, what the dose that the guideline recommends, I actually feel like it's inadequate, especially for Black people. And I always tell people to take a bit more, especially because especially if they've got other conditions, because we, in a way, are more affected by certain diseases that cause inflammation and impaired immune responses. And this is one of the reasons that I think some of the data has shown so far why we're a little bit more likely to be affected by COVID-19 in a bad way. And some of the unique factors that I feel affects us as Black health and well-being. And it's really interesting because the last few years that I've been doing this, I've had to search really hard to find information specific to us. You know, I think especially with the Black Lives Matter and my experience over the years, it's really made me very focused with what I'm doing. It's like, okay, if a drug rep speaking to me, I want to see, you know, what information you have specifically related to Black people. And these are some of the things that affect our health differently. So the melanin, you know, we don't have as much sun as we're used to. That is also actually, there's information to suggest that may actually also be linked to hypertension because of the way we process salt. Age, hormonal imbalances, you know, amongst women, especially the way we absorb stuff and our weight. So it's just being aware what we're taking, the right dose, the bioavailability, as in how we're absorbing it, and all those things are really important. Vitamin Z, sometimes you need a higher dose in certain things, but if you take too much at once, you may not necessarily get the right amount in. So that's kind of really my perspective on that. And also, it's the fact, I just really wanted to raise awareness that diseases, medications as well, apart from lifestyle and our age, all contribute to deficiencies that can increase vulnerabilities and make things worse if we have certain conditions. So this is all part of the things that I try to cover when I'm doing a consultation with someone. I don't just look at them and say, okay, yeah, vitamin D, you need a bit more. I look at the full picture. And most people, by experience, most people's needs, true needs, are almost always likely to be individualistic a lot of times. So yeah, so this is just some useful information if anyone wants to take a picture, etc., so they can find us and follow us on social media. But I'm sure B.O.E and Jeremy will pass that information as well. So that's what I kind of wanted to talk about when it comes to the talk. And I really, at this point, really want to take questions and throw open the floor. This, I guess, for me, was meant to be a live session. And, you know, I'm planning on doing another talk where I have a guest speaker talking about herbs in a lot more detail, the history of herbs, the spiritual element. You know, many of us are religious. How does that tie in? So we're going to go into a bit more depth. So I don't really like to, you know, repeat stuff. So I don't see the same point talking about the same thing twice. So what I really wanted is, if you've got any questions on what I've said, and also I really want to hear people's experiences with using herbs, what drives them to use herbs, and, you know, what difference do they feel it's made for them, kind of thing. So it'd be really interesting to hear your experiences. So at this point, I'll just take any questions.
Before anybody else jumps in with questions, I'd just like to just to back up some of the stuff that you were saying. I always have this sort of feeling whenever I'm prescribed anything from like the doctor, where are they getting their information from, and is it just like generic information that they're getting, or is it actually for people of my color? Because it seems to me like we're often just put all in the same pot and one size fits all, when I know that is not the case. And so, like you were saying, consultations and things of that nature, they're really helpful, and it's a one-on-one thing, and it's about you. So it's always a great thing. I've got a quick question before anyone else jumps in, and it's not too much about the herbs. I'll let everybody else ask them questions. It's more about the theme of our month. So obviously the theme's all to do with businesses that were set up in 2020, just like yours. How has all the COVID and everything else that happened last year actually affected your business? Has it affected it in a positive way, or has there been a real negative impact on your business?
I think the honest answer to that is time will tell, because we're a work in progress. I think for me, like I said, the BLM, I think, made all of us reflect, not just, you know, in terms of what we're doing and how we're doing. And I think I had been thinking about this even before BLM. But when BLM came, COVID-19 came, it kind of really emphasized the importance of what I'm doing. And I think I kind of tweaked what I was doing a little bit, in the sense that when I first started, I was just like, I'm only going to deal with people living with HIV. But I think when COVID-19 happened, especially, when I say that not that my door was closed to other people, because during that time I was still doing consultations with people that, you know, had different conditions, you know, eczema, weight loss, whatever kind of thing. But in terms of my focus, in terms of what I was saying to people and who I was trying to talk to, and I think when COVID-19 happened and the BLM happened, it just, number one, it made me feel that what I was doing was the right thing. It inspired me more to, you know, dedicate more to do it. And then the challenge was, how do I reach people in my community? Even though I'm in that community, you know, how do I reach the people I know that need my help, and how do I package myself? So I think those were some of the things that came to mind when COVID-19 happened and when I set up the business. So it's helped me to grow. It's helped me to focus. It's forced me, more so than before, when I look at information, when I'm studying stuff, when I'm, you know, speaking to drug reps, whatever, I force myself, because in mainstream, it's very general. But now when I go back and I look at Public Health England, I look at some of the information out there, I look at it a bit deeper. You know, like the vitamin D, I'm saying, okay, I'm looking at this study. Yes, it's Public Health England. They've made recommendations. But when I look at it, it's like, well, hang on a minute. There was only like 2% of those people that were Black. So is that really representative? Does that really apply? So for me, it's made me look deeper. From a business perspective, I think that's a good thing in terms of me being able to position myself to serve a community, because I feel it's put me in a strong position where I know that if someone comes to me and I'm talking about diet, I can be honest, they can tell me, okay, yes, I have a lot of ackee or I have a lot of plantain, and I know what kind of things I'm thinking or looking or how to advise them. Whereas I know that we're not taught that in mainstream, and most mainstream providers would just say, you know, eat enough vegetable and fruit, you know, eat healthy, and that's where it will end. Whereas I can be more targeted. So those are good things, which I think hopefully will, you know, will help in terms of moving forward. Probably the downside is that it's been a bit limiting in terms of the nature of the service I do. So I haven't necessarily been, some of the plans I had around marketing has been a bit limited, because opening up in the middle of a pandemic, not being able to go to people, it's a personal service. So sometimes you need to engage people and speak to people. So it's been a bit limited in that respect. So I guess there's been good and bad.
Cool. Yeah. That were my thoughts, actually. What you've said, it's about digging a little bit deeper than the average, and just looking and researching for yourself. Like, I've taken vitamin D cod liver oil ever since I was quite young. It was something that my granddad made me take, even if I didn't want to, and because of the taste. But yeah, it's, again, the dosage which it tells you on the packet, it's generic, isn't it? So it's about digging a little bit deeper and finding out for yourself exactly what is right for you. So yeah, thanks for that. Another quick question that I had as well. Obviously you talked about health service in the UK. How has your business been received, and have you come across any obstacles from the health service in this country?
I don't know that I would say, again, it's a work in progress. I don't know that I would say there have been challenges, because like sometimes, especially when I first started and going to certain places and certain people, the pharmacy industry is dominated by certain communities, so to speak. Ours isn't one of them, you know, so to speak. So when you're trying to engage people, it's been a bit challenging in that respect, because I don't come from a family of pharmacists. kind of thing. So I don't, and most people in my generation that have set up pharmacies, it's almost been like an extension of the family business. So they've inherited it, etc. So I've had to start from scratch in terms of funding, also in terms of learning, you know, not the clinical stuff. I've got the knowledge, but in terms of the business side, etc. So that's been really challenging. And I remember in the early days when I was trying to set up, I spoke to someone and it just felt like I was judged because I was asking them to do something. And I said, okay, I'll be ready to do this in a couple of months. And they were like, oh, I don't normally like working with people that I feel can't afford to pay, that are gonna owe. And I was like, well, where did that come from, kind of thing. So this is where these are some of the challenges that feels like things are a bit slower than if I had some of those backings behind me. In terms of other obstacles, I think, you know, like I said, like in terms of some of the specialist services and trying to fill some of the gaps, you know, approaching some people, part of it you could blame COVID-19, but approaching some people weren't necessarily as helpful as I felt they could have been, considering these are issues that affect this community that you say you're trying to address and help, and you have someone that's come. So these are some of the obstacles and challenges that one has faced.
Cool. Right, I can see that we've had a couple of questions in the chat. So let me just scroll through. So someone's put, what has been your biggest challenge setting up your new business?
I think biggest challenge is learning how to sell, you know, right, and learning what to say to people, because I think when there's been a lot of people that I send the information to or I put the stuff out, and now I'm learning that they don't really get it, because when I speak to people and I have a conversation about what I'm doing, it says they're like, oh, wow, okay, I get it. I would actually like something like that. But when I put the information out, like maybe I haven't put it the right way sometimes, so it hasn't had the right impact. So I would say the biggest challenge is learning how to market effectively, so to speak, kind of thing. I think that's something that I would say I'm still learning. I know a lot of other businesses are learning that, but I think when you're not necessarily coming from that background, you kind of have to force yourself to try and find a way of learning really quick. So
definitely. But yeah, again, it's on the job learning. So you learn, the majority of your learning is done from mistakes as well. So you have to be in it, don't you? So you've got another question here. Are you looking at engaging people in the UK only, or are you looking from a wider perspective, such as Africa, USA, and the Caribbean?
Yeah, so our services are open to anyone. So if you're wherever you are, you know, we're looking to engage people that feel they can benefit. And I have had a few clients that have been from abroad internationally. So yes, you know, like it's, and that's one of the reasons why I specifically set it up online, because even in terms of when I was working, and I did a lot of my training and work in a lot of the bigger teaching hospitals in down south, but along the line, I had to do some stints up north and abroad. And I noticed the gaps in healthcare, especially in rural settings, even in the UK. So if you're a Black person living in, I don't know, somewhere like, you know, some little village up north, the kind of service you'll get, the kind of people that will be delivering the service, they mean well, but, you know, from a cultural perspective, etc. So I set it up online so that anybody that needs the service can easily access it.
Right, guys, any more questions from any of you guys tuning in? I know you all go shy. Let's see. We've got another question come through. Right, it says, as an individual, how can we find what's right, the right balance of vitamins and biotics, etc.? So it's about trying to find the right balance between of like the different vitamins and the different things we should be taking. How do we find that information? I'm guessing it's by reaching out to you guys and having a consultation.
Yeah, and this is it. It's not one size, you know. I mean, I know that generally people will say like, oh, you should be taking vitamin D, and you'll see different blogs, but it is, in my experience, it is very specific to where you are in terms of taking the right balance. And you know, you have to be careful because some of the supplements, there's so much marketing, it's a minefield because it's not regulated as well. So some of them, they'll put things with the supplement that you don't really need. And apart from paying more for it, you know, it could be something that's in excessive. Like I know someone that was taking a particular multivitamin for pregnancy, and they ended up taking, number one, so much of one of the vitamins, the B12, that they didn't need. Number two, they ended up taking something that they gave them spots and, you know, reacted to. So, you know, we had to tailor it a bit more. So finding the right balance, again, if you're on medication, some medicines we need to think about, you know, metformin is a common one used for diabetes. We know that it decreases your B12. So we would want to take that into consideration. So it is very specific. And that's where we say, reach out to us for support.
Cool. I got sent a question earlier today. I'm just getting it up now. So yeah, this was more to do with mental health. So obviously in 2020, a lot of people, well, I know the data shows that mental health issues rose quite dramatically in 2020. Do you guys also look at prescribing certain things for dealing with more mental health and well-being rather than physical health?
So when it comes to mental health, it really depends on what you're talking about. Would I prescribe something for someone with psychosis, or, you know, probably not, kind of thing, because I don't think I would be the right person, or it would be the right setting. You know, in general practice, we normally prescribe such normally on the advice of the psychiatrist. Occasionally, I'll start someone on an antidepressant if they've been on it before, they want to restart it, etc. But with things like that, we are generally very careful for a lot of different reasons. However, that being said, there are some people that they just feel like they need a bit of a pickup, etc. There are some herbs that can help in that respect, just to, you know, make you feel better. But in terms of the services, so when I'm doing a consultation, even weight loss, you know, mental health, not a lot of places talk about it, but it actually has a great impact. So we take that into context with what we're doing, kind of thing, and help to support, kind of thing. I actually wrote a chapter about mental health and coping, mental health and coping in my first book, which was Truth About Health Exposed. So it's something we would talk about and we would support. But in terms of prescribing medicines for it, I probably wouldn't want to do that in, you know, under these circumstances.
Yeah, because I know a lot of people who may be suffering with like depression, or they might have lost their job, or they might just be stuck in lockdown in a house by themselves. So I think it was more from that side of things where they're talking about, rather than using prescribed like antidepressants and stuff like that, is there any more like natural herbs and stuff like that which they could use?
There are definitely a few herbs, and if you wanted to make that the first step, you know, these are part of the things we would consider and say, okay, you're feeling a bit low, maybe try this before you go down the antidepressant route, kind of thing. And I know what you said, because even in practice, I've had so many patients who have said they still don't feel comfortable leaving the house, and you know, it's a big issue. And like, it's worse because some people, especially loneliness, etc., and then it becomes like a vicious cycle.
Yeah.
And we normally sometimes will give them an antidepressant, etc. If you're not at that stage and you want to try something a bit milder, or then definitely there are like a few herbs that you can use to help, you know, in that area.
Good, good. Any more questions from anybody this evening? You can type it in the chat if you're feeling shy. As I said before we started recording, a lot of the time we get a lot of questions and engagement after the actual live. So anyone who doesn't want to ask the questions right now, or anyone who is just tuning in a recording session, you can always send through any questions you've got to B.O.E, and we can make sure it's forwarded on. Or a question's just come through. How long are the consultations?
So the way it works is, for most people, it takes 45 to 60 minutes to have that first initial consultation, where we go into really great detail, and it's really about me getting all the information I need in order to come up with a plan for you. So then after that, after we do that, I go away, I think of a plan, I then come back to you and share it with you. Normally that doesn't take too long, 10 to 15 minutes. And if you've got any questions, then you can ask. And then we do a couple of follow-ups, normally monthly, not more than 15 minutes to touch base, see how you're at. So that's how the service works. For weight loss, it's a little bit different in that we will probably touch base with you briefly every fortnight minimum. With weight loss, to be successful, the evidence says that you should have follow-ups. I think it says at least 6 over 3 months. So we try and give you 3 of those for free. And then depending on your need, you pay not a lot. We don't charge a lot for that follow-up, but if you need it, we charge a small fee. Otherwise, some people might feel they're okay, they know what they're doing, kind of thing. So
cool. Any more questions from anyone? No?
So I would say, like, I have a question if no one else has, if someone would volunteer, and anybody can answer this, like in terms of, what's the attraction for using herbs for you, kind of thing. I'd be interested to know, and how helpful people, have found. Just to give an example, I just wanted to have, a bit of insight.
So has anyone out there used herbs before? And if they have, how helpful have they found them to be? You can just type it in the chat if you don't want to come off mute. Me personally, I haven't used herbs before. In fact, I'm lying to you. When I was young, my mum and my granddad used to it used to grow. He had a greenhouse in his back garden, and he used to grow like mint. And anytime any of the kids had any stomach problems or bellyache and stuff like that, he used to boil mint and like give us mint tea. And that's kind of the same sort of thing, but it used to work. So in that respect, I have tried it before, but not as an adult. I haven't tried anything as an adult.
That's interesting, because I kind of, you see, it's so rampant if you go on the blogs, etc. Like it feels as if everyone in the community is, kind of thing. So yeah, it's interesting you said that. I think it's something that I think in most families, there are things that have been used from a herbal perspective, and it's things people are familiar with. And I think, especially as a community in Africa, the Caribbean, it's, quite a big thing, kind of thing. So but like I said, it's just trying to use it in the right way, kind of thing. And I think conventional medicine over time has evolved, and the way we use it. But I think sometimes I feel the way herbal medicine is used, we haven't necessarily evolved as much, and I know there are some schools of thoughts, especially in Africa, that says when slavery and colonialism happened, that it put a stopgap in the development of African medicine, so to speak. So, conventional medicine took over, but now you have a lot of people going back to herbs because it's cheaper, it's more affordable, and it's more accessible than others, kind of thing. And yeah, so I think it's just interesting sometimes to hear different perspectives about, what drives people, because I know some people that are very hardcore and are like, they don't want to take anything that's medical, kind of thing. And when you break it down that herbs are actually a form of medicine, it's like, oh, I didn't think about it like that.
Yeah, I think as well.
I think sorry.
Oh, go on, Yvette.
I was just going to say that like Jermaine, when I remember, you know, as a young person, I think we were more apt at taking and using herbal things. As a little girl, I remember having to drink, I don't even know what herbs there were half the time. You know what I mean? Just that I knew that they just tasted absolutely disgusting, and that were it. You know what I mean? But not to say that they didn't work, because they worked. Although they weren't nice, they were disgusting. You know, they worked, and you know, it was generally the go-to. I remember when I was in labour, and I wasn't well at the time. It was with Joelle, my eldest, and my mom, she gave me what is it, thyme tea to drink, just thyme tea with honey, and I drank it, and I think it probably sped the labour up, and two, whatever else was going on within me seemed to disappear. You know what I mean? In terms of the fact that I wasn't well and I was feeling sick and stuff, and I wasn't doing too well at that stage. So again, sometimes it's just the simple things that you just don't know. I mean, I don't know the properties, and I've never really delved into using herbs and stuff like that. I do use vitamins, but like you were saying, there's so much controversial about vitamins, and I'm never sure whether I'm using the right ones or not, or whether I'm using good quality vitamins, or even that's it exactly, or the right amount for what my body needs. But in terms of herbs, yeah, like I said, mainly when I was younger, yes. But it's something that I don't know. I think that's the trouble with I think with a lot of I can only speak for myself. For myself, in terms of my mom came from from Jamaica, from the West Indies, and brought those kind of herbs and used it and gave it to us. But I never continued that with my own kids. You know what I'm saying? So maybe that's something that I probably should have done. Yeah. Maybe I should have probably found out more about the benefits, or you know, or what it was that my mom was using in terms of herbs and
I think leaves. Yeah, this is the thing with herbs, because it's not like conventional medicine where we'll say, okay, take this tablet and that's it, you'll be done, and there's evidence like papers. You have a lot of information coming out now about different herbs, but a lot of it is historical and anecdotal, and you're kind of reliant on history. You know, like I remember, you know, when we were small, my parents from Africa and Nigeria, and sometimes if someone had a cold, they'd give them certain things like snuff or like color nuts or certain things, you know, and it's very historical. But like you said, a lot of time it works. And even now, when you start to understand herbal medicine, and I've had to learn and, you know, talk to older people in the game, and it's the principles, and this is where I think conventional and those academics that are like, oh, it's a load of rubbish, don't really understand. It's the principles that govern it. And now some of the science is interesting when you start to look at the data. Some of the science is proving those principles right.
Right.
So our ancestors learned, like, for example, they say like hunters, maybe back in the day, they'd look when an animal injures itself, it might go to a plant, and they would know that, okay, that plant might have something in it to stop the bleeding. And so it's been learned by observation, by history. You know, they've learned what not to do, what not to do. But it doesn't mean that, this is what I meant by it needs to keep evolving the way it's used. Now that we know more about conventional medicine, some conventional medicines are based on herbs anyway, but it's the convenience. You know, a lot of people, it's easier to just pop a tablet. I remember someone asking me the other day that, oh, you know, they don't want any herb for that. They've got a bit of constipation. Look, I need something that's going to work quick. You know, so it's like, okay, here you go, have some senna or what have you, kind of thing. And because herbs are more gentle, so sometimes they take a bit longer to work, and sometimes that's why I'm like, it's how you use it. If someone's got an infection, you probably want to take an antibiotic that's going to knock it on the head and stop it from manifesting, right? Rather than a herb. But, you know, that doesn't mean over time you couldn't take some cranberry juice. It's a common one to prevent yourself from having regular water infections, but it works over time to prevent, not necessarily if you've got a really bad water infection. The other day, a herbalist, you know, was saying that, oh, they've told me I've got a kidney infection and I just want to know what herbs. And I was like, you know, you probably want to take an antibiotic because that's quite serious, you know. And I think even one of the older herbalists in the network was like, actually, it could be really serious. So, you know, I really believe it has its role. And, you know, like, we have to learn from history and not forget the history, but we need to put it into context for our generation, is what I think, kind of thing. And the way we're living is different from the way our parents or grandparents were living. So the way we use these things has to evolve as well.
Yeah. And it's that thing of also of using those herbs on sometimes on a regular basis in order to prevent rather than just to cure. You know what I mean? So yeah, definitely. And this using it safely. There are some that are can be quite dangerous and potent, but there are some, like I said, on a regular basis can support your well-being. And it's probably better for you to drink some thyme tea than it is for you to have a cappuccino. You know, that's
like you said, a lot of it is generational as well, isn't it? So it is from our parents and our grandparents, and it's lost the loop once it reached a certain age group. And generally now in this modern era that we're living in, like you said, there's not the data out there to support people wanting to actually go for herbal and different things like that, where they just want a quick fix. But like you said, it's not always about replacing something with something else. Sometimes it's about supplementing what that you might be prescribed with something else, just to prevent it from happening again or something like that. So I think that's the key message, isn't it? Cool. Has anybody else got anything they want to ask? No.
So I just wanted to say something as well. Like I said, I really think what you guys are doing is such a great thing. And one of the things I was thinking about coming on here, I mean, I haven't set it up totally, but if there's anyone listening or in the chat or moving forward that is interested, I wanted to offer like a discount for our services for people that are interested in it. So I'm in the process of setting that up, but if people want to send their email or something, and then I won't send spam, we don't do spam, you know, but then I can forward them that code. And I guess it's just a way of engaging and, you know, us trying to, I guess, just make it a bit easier for people that want to patronize us as well. But I just felt like, doing something in a way.
Yeah, that's a really good idea. And what we've got as well, obviously everybody who's RSVP'd for this event will have their email address already saved. So what I can do, I can get that information, collate it together, and I can pass that over to you. So if they want to, they can use the promotional code that you're going to offer. But yeah, thank you for offering that. So I'd just like to thank everybody for coming and joining this event this evening. A lot of useful information there shared with us. Lots of things to think about moving forward, to making sure that you are looking after yourself right. And like we've said, it's all about managing your health effectively, and especially in the times that we're living in now. Everyone is so health conscious. It's just about making the right decisions, doing a lot of research, and making sure that you're just looking after yourself and your loved ones. So thank you again, Funke, for taking this session. I'll just talk a little bit now about what we've got coming up for the rest of April. So we're still using the same theme, 2020 businesses. So we have 3 more Black-owned economy live rooms set up. I'm not going to tell you what they are. What I want you to do, if you're watching this recording or if you're looking live, I want you to head over to our website at blackowned-economy.co.uk. Head over to our events section and have a look at all the wonderful events that we've got lined up in April and beyond. Go on, click on the event, RSVP it. It'll give you more information about each specific event, and it'll also send you the Zoom details so you can join on whenever it is. If you haven't managed to join us live this evening, this session's been recorded, so I will put the recording over the weekend on our website, and I will also put it on our YouTube channel. Our YouTube channel, just for everyone, is Black-owned Economy Presents, and there's a playlist section for B.O.E. Did you just want to ask something then?
Yeah, just quickly, I just wanted to let whoever's listening and anybody know that if they want to learn a bit more, I've got a specific herbal session. I've got a great herbalist as well, who's actually, it's really interesting how I found her, but she actually, her background is as a Rastafarian from Jamaica, but then she's kind of gone to Africa as well, learned about herbalism. She's got the piece of paper, she did the degree to back up her stuff. And so she's going to be talking, and we're going to be talking in a bit more detail. So if anybody wants to join us, and that's going to be on the 25th on Sunday, which I think is next Sunday. Yeah, so next Sunday. So I'll post up that as well on my page and send it to you. Yeah.
Cool, nice one. So yeah.
Sorry to interrupt. So what you're talking about, is that going to be on Zoom as well?
Yes.
Is it going to, so are we going to, in order to access that information, do we have to go onto your website then? Is that what you're saying?
I will send it to you again, but yes, if you go onto our social media, if you like us on Facebook, Twitter or Instagram, the information will be up there as well.
Yeah. So what I will do as part of this, I'll make sure when I'm editing the video that I've presented all your socials. So that is your Facebook, your website, your Instagram, everything. I'll make sure that it's posted so everyone out there knows how they can get in contact with you. They know how they can reach out to you if they've got any questions, if they want to book a consultation. All the information will be posted. I'll also follow this up with on the original post on the Facebook group. I'll put some more details on that post as well. So yeah, thanks again to Funke for this evening, and thanks to Black-owned Economy for RSVPing and coming to the event, and continue to support each other. I'll look forward to seeing you all soon. Thanks again. Bye.
Thank you.
Thank you. Bye.
Bye.
Thank you. Thank you guys for coming.